Good morning. My name is Tom Blonsky, and I am from Catholic Charities, New Hampshire. I want to start by expressing my profound appreciation for allowing us and choosing us to be part of this incredible program with the Miller Center for Social Innovation at Santa Clara University. And I want to start by thanking Jeff Pilisuk for his leadership, for my wonderful mentors, Louis Jordan and John Scaramuzzo, for their patience, for their guidance, for their support, for their leadership as well. It has been invaluable during this unprecedented time. So just to give you a little bit of context about Catholic Charities, we are a relatively large human services organization that covers the state of New Hampshire. We're northwards of $83 million and 1,000 employees, and are split into two divisions, social services and healthcare. So to start off with our vision, let's say going back to last November at our annual board retreat, our board reviewed and approved moving in the direction of exploring different senior living options, which included the potential to develop affordable senior living apartments to complement our existing long-term care continuum as part of our organization's strategic plan. So that included the exploration of hiring, or whether or not to hire a new director of business development or consultant who was currently or is currently working in the field of senior affordable housing and or understands, and really more than and or understands the world of tax credits tied to that. Also at that time, we began our work with the Miller Center mentors, Louis and John, as I mentioned earlier, and discussed various models, what those would look like, and need and impact. Unfortunately, this past March, everything came to a standstill where we, at the board's direction, really, hiring came to a freeze and all non-essential expenses also were frozen. So just to give you an example of New Hampshire at a glance, to put it in a nutshell, we are the second oldest state in the nation and the 14th most expensive state in which to live. We are also on track to become what's known as a super aged state within the next 5 to 7 years, and thereby we will then have 20% or greater of our residents over the age of 65. Another tidbit from a national perspective is currently 23 million individuals in the US are over age 75. Within the next 30 years, that number will catapult by 117%, whereas an additional 27 million individuals over the age of 75 will be living in our midst. So a lot of opportunity there. From an economic perspective, 45% of baby boomers have no retirement savings. Of the remaining 55%, 28% have fewer than $100,000 in retirement savings. Therefore, it looks like about 60.4% of our baby boomers are relying predominantly on Social Security. This doesn't bode well for their future or who's going to be able to pay for their future and their living expenses. One other little tidbit in regards to need and seniors' need, or what they're dealing with financially, is our mobile food pantries and who our customers are at those mobile food pantries that are provided by our New Hampshire Food Bank that provides weekly mobile food pantries throughout our state. And currently 35% of our customers from those weekly food pantries are residents in our state over the age of 65. So after, I would say in the last year and a half, we've had various stakeholder meetings, statewide meetings with deacons, with seniors, with business developers around the state, business developers in regards to housing development. And there were three clear needs that showed up because of that. One being the need to reduce isolation for seniors. The second would be access to transportation, certainly mostly in the rural parts of the state. And the most resounding need was for affordable housing for seniors. Coinciding with this, we had also done a series of feasibility studies for various parts of the state looking at market rates housing for seniors. That was one of the buckets we were looking at during that time. And looking at current occupancy levels or census levels for independent living rentals for seniors in different parts of the state at the income level cut of $60,000 to $70,000. we had a low of 98.4% in Windham to a high of 99% occupancy in Nashua. Those are both at the very bottom of the state, closer to Massachusetts. Massachusetts and Laconia are closer to the central part of the state. And even at the $60,000 to $70,000 income level for seniors, we had an additional need of 140 new units in Laconia to a high of 818 units in Manchester. So there really is a need out there, and even if the cut is at a much lower income level, which we're looking at, I mentioned earlier, $25,000 to $45,000, there is an even greater need at that level. So currently, Catholic Charities operates 7 nursing facilities, 2 assisted living facilities, and 4 market-rate senior independent living rental communities in various parts of our state. So to complement this existing continuum of care and to build upon our expertise in senior health care and to move beyond our heavy labor-dependent, low reimbursement, and highly regulated nursing home model, we're looking at additional ways to serve vulnerable seniors in our state. So part of this is early on we looked at developing a logic model theory of change. And starting with mission, we are looking to increase access to affordable senior housing and reduce social poverty in northern New England. And through the activity of over the next 10 years, building a minimum of 250 affordable senior living rental apartments for the 62-year-old plus population. If we were to look to be more aggressive with this and build 500 units during that time frame, our 4 projects, if we were to do 60 to 80 units at a time, we would end up at 250 units. If we were to look at 500 units, it would be closer to 100 to 150 units at a time. So our market rate for this activity would be church seniors, senior centers, community action programs, and various social service agencies around the state. These complexes would be constructed in areas that match the need and availability of Catholic Charities services and programs, wraparound services around those areas where we would construct these facilities. So the outputs we would be looking at are for residents to be more engaged and in control of their life and to have more choice in regards to preventative care, in regards to access to transportation, socialization, and activities. The outcomes related to those choices would be reduced isolation and better self-management due to the ability to more readily access needed services. The long-term impact of this would be that seniors would be able to remain independently in their homes for longer periods of time, thereby reducing unnecessary or premature nursing home stays. Wraparound services and needs would be addressed sooner so that we would prevent any healthcare crises from coming up because of lack of access to those services. So looking at our future, our goal is to provide more affordable senior living independent options with ancillary support seniors, targeting seniors of incomes of $25,000 to $45,000. So with this, we would look to partner with Catholic Charities Social Services to offer volunteer rides for medical appointments, light case management and counseling or telehealth services, and potentially food pantry development, a food pantry that would be embedded in each of our complexes, and or daily catered meal support from our food bank if a food pantry wasn't necessitated or there wasn't an indication of or a willingness of support there. Other partnerships would include a part-time nurse clinician or clinical support or office support hours 2 to 3 days a week. We'd have an embedded nurse office in there in our complexes that would be provided by Catholic Charities or even a partnership with the local visiting nursing association of VNA. We would also embed a beauty shop or beautician services and a part-time activities coordinator or exercise coordinator that would potentially be fee-based if we weren't able to locate a volunteer to provide that service. So the model would also offer Catholic Charities the opportunity to create future referral services for our nursing homes in the event that subacute or dementia or even long-term care needs were to arise among our residents in our facilities. And looking at senior or similar models that currently operate in our state, and there really are only a few at this point, who are following their formula, quote unquote, for low-cost housing, we really would have to look at securing tax credits, and our goal would be to qualify for 9% tax credits, 4% tax credits, or a hybrid federal tax credit which would also be complemented by no interest New Hampshire HEFA loans in order to address the financing gap for the cost to build these units. I've also outlined what those percentages would look like in terms of units at the particular percentage of area media income, what those would look like potentially. So looking at the timeline, a typical development timeline is anywhere from 3 to even 6 years at a long point, from concept to permits to applying for tax credits and even getting approved for those. You don't always get approved on the first go. To financing and even to what the finally what the build looks like, and that can run anywhere up to 2 years plus, depending on if there are significant change orders or issues that come up in the build. So looking at the future and building a foundation, over the last 7 months, we've met with the New Hampshire Housing Finance Authority to learn about and discuss financing and tax credit options. We participated with the Miller Center's webinar from Eden Housing that reviewed similar materials, tax credits, and what that looks like and what we needed to look at and stay ahead of. And during that time, we've also looked at some properties for potential development. With that, like I said, our goal is to build an initial 60 to 80 units. If our longer term goal is 500 units over 10 years, we'd have to move that up to 100 to 150 units at a clip. During this time, we've been working with an architect and area developer who have completed multiple affordable senior housing complexes and really understand very well the arena of tax credits. So two of the properties or projects that we looked at, one was a vacant school property, the other was a closed church. And when all was said and done, really they only allowed for a build out of 28 new units once they were retrofitted. So these numbers were really too low to work for us. The third property, which included a whole campus, a church, a school, and a rectory, had the potential for 60 plus units of additional senior affordable independent living units. Unfortunately, before we were able to get too far with this process, our bishop decided that he had other plans for the property, so that did not work out for us. So right now we're at the point of continuing to look